Good morning to all. I am Professor Manavalam. Now I am going to continue with the cardiotocography, that is one kind of non-invasive procedure that is applied during the time of later weeks of pregnancy and during the time of labor to monitor the maternal contraction as well as fetal heart rate. That we are going to see about we are going to see about the part 3 of cardiotocography. In this, certain parameters which we are measuring during the time of cardiotocography that we are going to see in this. Mainly we are going to concentrate on the acceleration of the fetal heart and the deceleration of the fetal heart rate as well as what is sinusoidal pattern. First we will see about what is acceleration. So in previous video we seen about the baseline fetal heart rate. So baseline fetal heart rate, it lies between the 110 to 160 beats per minute. That is the baseline fetal heart rate. That is normal fetal heart rate. But in some time there is an abrupt increase in the fetal baseline heart rate greater than 15 beats per minute. It remains for 15 seconds. It is remain in that state more than 15 seconds, then it is called as a acceleration. If the acceleration is present in the cardiotocography, means it indicates that the fetus is reassuring. There is no complication to the fetus. Fetus is healthy. That it is indicating like that. So if the acceleration that occurs along with uterine contraction, means then it is indicating that the fetus is very healthy. No need to worry about the fetus that is present inside the uterus. So always the acceleration as well as deceleration, it is occur along with the uterine contraction that is experienced by the mother during the time of labor. First we will see about the acceleration. So here the below the second box and first box is the longest box. In the second box it has given as a TOCO. The indicator has given or name has given as a TOCO. TOCO means it is indicating the uterine contraction. So the wave-like structures are there in that. So the wave, whenever the baseline intrauterine pressure, the 20, 40, 60 and 80, it is indicating the intrauterine pressure. It starts with the 20. The uterine, whenever the uterine contraction, it starts the elevation of line we are seeing, no. So elevation of line, it starts the intrauterine pressure. It starts from the 20 to its end up with the 50 and it's coming down, and the flat line is. Flat line means the mother in the resting period. Then next contraction is started. So in between 10 minutes period of time, in this, according to this graph, there are two uterine contraction. So according to this contraction, there is a changes in the fetal heart rate. So the above graph, the above box, the graph has given. In that in that graph, the baseline fetal heart rate is, it starts as a 120 to 130 beats per minute. Most probably it is 120 beats per minute. But there is a variation according to the uterine contraction. There is a variation is there. So it is increased from 120 to 145 beats per 150 beats per minute. There is a changes, variation is there. So the variation must be between, it must be 15 beats per minute. It must be remain for 15 seconds. Then it is indicating acceleration. Next, deceleration. Deceleration means it is opposite to the acceleration. There is abrupt decrease in the baseline fetal heart greater than 15 beats per minute for more than 15 seconds. Actually, the fetal heart rate is controlled by the autonomic and the somatic nervous system. So whenever the fetus exposed in the state of hypoxia, in order the fetal heart rate, this is a one adaptive mechanism. The fetus is adapting during the time of there is a changes in the oxygen supply and the blood supply. Whenever the fetus exposed in the state of hypoxia, the fetus heart, it reducing its heart rate. It means the pumping, the heart pumping, it will be getting reduced in order to preserve the blood that needed for the myocardial tissue for myocardial oxygenation and myocardial perfusion. So in order to save the tissues that is lining the cardiac cavity, so these are all the adaptation the fetus is the cardiac system is undergoing. So that's why there is a variation in the fetal heart rate that is called as a deceleration. There are different types of deceleration. First we will see about the early deceleration. Early, in the word itself we will know, because here the acceleration, the heart rate is mainly based upon the uterine contraction. So here also the early deceleration means there is a deceleration. The deceleration means the decreasing the fetal heart rate. It starts when the uterine contraction begins and it recovers back into the normal state when the uterine contraction stops. So the deceleration, it starts when the uterine contraction begins and it recovers when the uterine contraction stops. The causes of early deceleration is because of the head, it will be getting compressed between the pelvic cavity, pelvic bone. Whenever the fetus is in the process of labor, while the process of it is descending, so it is automatically, it is undergoing the great pressure. Because of this pressure, there is an increasing fetal intracranial pressure that is causing increased vagal tone, that leads to some of the changes in the fetal heart rate. So in this graph sheet, it is clearly seen during the second contraction, the fetal heart rate from 120 beats per minute, it get reduced into 90 beats per minute, and when the contraction ends, it is also coming to the baseline. Next, move on to the late deceleration. So late deceleration, it begins at the peak of the uterine contraction and it recovers after uterine contraction ends. The main reason for this is placental insufficiency. Because of placental insufficiency, the fetus have the hypoxia and fetus end up with the fetal hypoxia and acidosis. The reason for late deceleration, the maternal factors also playing major role in this. So in this graph, we clearly see about the deceleration. So the basal fetal heart rate is 120 beats per minute, but that is starting to decrease when the peak of uterine contraction, and it is recovered to the baseline when the contraction ends. The main reason is maternal hypertension, preeclampsia, uterine hyperstimulation by the drugs, example oxytocin. Next, variable deceleration. Variable deceleration means it means that there is no relationship between the uterine contraction and the fetal deceleration. Variable period of time, there is a deceleration or decreasing fetal heart rate that is present, that is called as a variable deceleration. So in this graph, we clearly see about clearly it is indicating that there is a deceleration in the above graph. It is not having any correlation in the contraction because it is happening between each contraction. So that is called as a variable deceleration. So variable deceleration, it is does not have any contraction, but it is one of the indicator that there is a chance of reducing the amniotic fluid volume. The mechanism of variable deceleration. Why there is a deceleration, acceleration and a deceleration. First, whenever the head is descending down, it will automatically compress the nearby. Because of contraction, every structure which will be getting compressed. In that, the first one is the umbilical vein is often occluded, causing the acceleration of the fetal heart rate in order to respond to the compression. Next, follow that. Next, umbilical artery is getting occluded, that cause for rapid deceleration. Then follow that when the head, it is because of contraction, the head is giving compression to the adjacent structures, mainly the umbilical cord. So when the contraction faded, the head is not giving compression over the umbilical cord, the umbilical cord pressure is getting reduced, means automatically the blood supply is good, there is acceleration of the fetal heart, it returns to the baseline fetal heart rate. So this is the mechanism behind the variable deceleration. This is about the sinusoidal pattern. There is no variation. It goes between only two. There is no acceleration. There is no deceleration. There is no variable fetal baseline variability. There is no variable deceleration. Nothing is there. It is going in a same pattern, that is called as a sinusoidal. So this is also indicating fetal hypoxia and acidosis. Next, how we have to interpret. We seen many things in this cardiotocography. So we are measuring in this uterine contraction, fetal heart rate, in that fetal heart rate, fetal heart rate, baseline variability, and we are monitoring the fetal tachycardia, bradycardia, fetal acceleration, deceleration, variable deceleration, early deceleration, late deceleration. So these are the things we are measuring with the help of cardiotocography. At the end, we have to come a conclusion of how we have to interpret and bring out the results of cardiotocography. So first one is reassuring. Already I said reassuring means it is indicating healthy fetus. So healthy fetus means they are lies in this category. There is the healthy fetus must have the baseline fetal heart rate between 110 to 160 beats per minute. The baseline variability must be there 5 to 25 beats per minute, and deceleration, no type of deceleration, but sometimes early deceleration is acceptable one. Next to non-reassuring means it is it means that we have to give some concentration over close observation. The fetus is needed. It indicating close observation is needed to the fetus. So under this category, some of the fetus are falling under this category. They are having the characteristics of baseline fetal heart between 100 to 109 beats per minute, 161 to 180 beats per minute. The baseline variability less than 5 for 30 to 50 minutes period of time, or more than 25 for 15 to 25 minutes period of time. Thank you all. I hope everyone understood very well about the cardiotocography. Thank you all.